So I'm happy to have the opportunity to talk with you this morning. I am from the National Institute on Aging with the National Institutes of Health, and I will be talking to you very much from data that's been generated by support by our institute. I was very specifically asked to talk about projections for population disability in the future, how disability may vary by race and ethnicity, and how this might affect family caregiving. So in order to talk about the future, we need to know what the present is, and these are data from the American Community Survey done by the U.S. Census Bureau and supported by our institute. And what it shows is that about 40%, very precisely 38.7% of older adults have one, two, or more problems with disabilities: vision problems, hearing problems, cognitive problems, self-care problems, ambulation. That percentage increases progressively when you look at people 65 to 74, 75 to 84, and 85 and over. What you see here is data from the National Health Interview Survey, which shows something that's rather promising. As opposed to 1997 through 2003, when people were interviewed 2004 to 2010 who were 65 and older, it appeared that they had less in the way of problems with arthritis, heart, vision, stroke, fractures than they did in the prior interviews period. The only thing that seemed to go up was musculoskeletal problems and physical functional problems. It seems that this is associated with less in the way of smoking, better education as people, various cohorts matured. The increase in functional problems seem to be associated with obesity. However, when we look to the future, there are concerns because when you look at those people who are near elderly, 40 to 64, current caregivers, future people in need of care, as opposed to 1997 through 2003. In 2004 through 2010, you see that there was an increase in problems in every parameter that's displayed here. The only parameter in which there was an improvement was with hearing. And this seemed to be associated with obesity. So a lot of concerns about whether the obesity epidemic is going to have an impact. Certainly there's some recent data suggesting that the obesity epidemic may be abating, but that's in the childhood group. Whether it's going to affect this group is not clear. And of course there's the issue of Alzheimer's disease. Currently, it's estimated that up to 5.1 million people suffer from Alzheimer's disease. It's projected that by the year 2050, some 13.8 million, with 7 million of them being those 85 and older. This is something that will be associated with cognitive and physical problems. So how does this vary by race and ethnicity? This is again from the American Community Survey, and in total, 38.7% have problems with disability, and it does appear to vary whether you're white, black, Asian, Hispanic. Other here represents Native Americans, Native Hawaiians, Alaskan Pacific Islanders. And there are a number of other things that seem to vary by race and ethnicity for disability. Whites and blacks tend to live alone more so than Asians and Hispanics. The green here is people living with others. That's generally family members. There's variability in terms of poverty levels, with blacks and Hispanics having higher poverty levels than whites and Asians, those who are suffering from disabilities. And as has been demonstrated by Judith Casper, Vicki Friedman, and colleagues from the National Health and Aging Trends Study, another study that we support that's some 8,000 Medicare beneficiaries, disability relates to income level inversely. This is lowest quartiles of income, highest quartiles of income. They looked at disability a little differently. These are people who are fully able, successful with accommodation, have reduced their activities, have difficulty in performing activities or require assistance from others. And as you can see, the frequency of requiring assistance from others or having difficulty or reducing activities increases proportional to a decrease in income. So how that relates to race ethnicity is to be inferred. Jack Gralnick, who had been the director of our lab of demography and epidemiology for many years, tried to look at this in a different way, trying to control for income. at least for whites and blacks, and what they looked at was poverty level less than 100 of poverty level all the way to greater than 500% of the poverty level. And they found for men and for women, whether it was looking at functional level or ADL levels, that much of the difference could be accounted for by economic status. 90% of the difference for men, 75% of the difference for women. How that further translates, what accounts for the residual difference is something that could bear further scrutiny. And then Seal and colleagues looked at larger groups. They looked at blacks, whites, Hispanics, Asians, controlling for living situation, socioeconomic status, age, sex, and found that whether it was mobility limitations, ADLs or IADLs, for blacks there was a persistent disparity with blacks faring worse than others. But when you started looking beyond age 75 or so, for both Asians and for Hispanics, whether it's ADL or IADL difficulties, they proved to have more challenges than blacks and then whites as time went on. So definitely some differences and some opportunities for further evaluation of what those differences might be. How might this affect family caregiving? This is from the National Study of Caregiving, a sub-study of the National Health and Aging Trend Study, again led by Friedman and Casper, that looks at the current situation for informal caregiving. And what they've been able to demonstrate is that the vast majority of informal caregiving is by family members, whether it's a spouse, daughter, son, or other relative, generally an in-law, less than 10% by non-relatives. And hours of caregiving will vary from as much as 110 hours per month on average from a spouse down to 61 hours per month by in-law, much less than that by non-caregivers. And these are not mutually exclusive. In their evaluation, most caregivers could identify at least one informal person, on average about 4 in their network, and a total of about 164 hours of care that's provided. As Eileen pointed out, for the future, we have reasons to be concerned. These are data from the fertility supplement of the current population survey. Women born 1944 through to 1959 had almost a doubling in the rate at which they went childless. That seemed to go down a little bit for the birth cohort in 1969, the women who gave birth at the beginning of this century. But on average, 1 out of 5 women are going without children, and so it's further demonstration of what Eileen showed in her family that went from 7 kids to just 2 kids, and something that it means that networks are going to shrink as time goes on. And of course, there's costs that's associated with this. Michael Hurd and colleagues, based on our health and retirement study, did a very nice evaluation of the cost of dementia care, looking at the direct cost, whether it's hospitalizations, nursing home care, or whatever, and then the total cost, which included informal care, whether it's the foregone wages for the individual or the cost that would be incurred if you actually paid for professionals to provide the care that those informal caregivers were providing. So the cost in 2010 for AD was about $110 billion. When you take into consideration all costs, it was $150 to $210 billion. Projected through to 2040, not even taking into consideration inflation, direct costs are anticipated to be about $275 billion. When you consider all costs, up to $375 to $510 billion. So very costly. So in summary, in less than 10 minutes, projections for population disability in the future are variable and will depend on the impact of the obesity epidemic and other secular trends. Current disability varies by race and ethnicity, with some data suggesting a moderation of differences based on socioeconomic status, and there clearly are other factors that could potentially be evaluated. Family caregiving will likely be impacted by the increased numbers of older adults with aging of the baby boom, just as Eileen said, changes in childbearing practices, and the health and physical ability of future caregivers.